Okay, all right, we should get going. We have a limited amount of time to talk about a very big subject. So I'm Mona Sarfaty. I'm a family physician and also public health trained. And I was here in Philadelphia for about 10 years working on trying to improve the management of chronic disease across the state of Pennsylvania. And I became very concerned about what climate change meant for people who have chronic illnesses. And that made me decide to want to work on this. And so about 4 years ago, I moved to the Center for Climate Change Communication at George Mason University, which is in Northern Virginia. And I started partnering with medical societies to see what physicians were seeing with regard to climate change. If climate change is supposed to be impacting our health, doctors on the ground should be seeing it. And so my mission was to find out what doctors were seeing. And so first, let me just say that I have no financial disclosures, but I do have some personal disclosures. And this is the next generation coming along in our family. So what do doctors think? We did 3 surveys with the Academy of Allergy, with the Thoracic Society, and with the National Medical Association. And we found out that doctors know that climate change is happening in numbers that are much larger than the population as a whole, approaches 90%. They know that it's mostly human-caused, and the vast majority think that it's directly relevant to patient care. And we asked whether it was impacting their own patients. And about half said that it was impacting their patients to a great extent or a moderate extent, and another 20% felt it was impacting their own patients at least a little. And so this led us to form what we call the Medical Society Consortium on Climate and Health. So right now we have 21 society members. Happy to say that the American Medical Women's Association is one of those members. And those 21 societies, which include all the large ones and many of the smaller ones, account for more than half the physicians in the United States. So it's more than 550,000 physicians that are now a part of this organization. So we launched in a little over a year ago, actually just about a year ago, and our mission was to inform the public and policymakers about the health harms of climate change and the health benefits of climate solutions. And we released the report, Medical Alert: Climate Change is Harming Our Health. And I've got some copies, and I'll put them on one of the tables up here after I finish speaking. So if anybody'd like to pick one up, they can. And it's also available online. And it describes the health impacts, and it gives the stories of 4 physicians who had some personal experience that they wish to share. So why did we release this report? Well, I'm in a Center for Climate Change Communication where they study what Americans think about climate change. And one of the things they discovered was that only about 1/3 of Americans think that climate change is going to affect them personally. They think it will affect those other people over there, someplace else, but not them or their families or their own communities. And so only a minority believe that climate change is a threat to Americans. But the reality is very different. Climate change is already harming the health of residents of the US in every area of the country. And this report is meant to fill that knowledge gap. So we know this because we're seeing this when we take care of patients. And so this is some of what we have learned. Now, climate change can be a risk to every American, but certain groups of people are at greater risk, and that includes children who spend more time outside. It includes pregnant women who are more vulnerable to both air pollution and heat while they're pregnant. It includes elderly individuals who, as we know, sweat less and have less of a thirst drive when they're, in fact, somewhat dehydrated, people with chronic illnesses and allergies, and also people with limited resources who may be able to not get out of harm's way when a storm is threatening. So what are those health harms? Well, the first I'll talk about is air pollution. And so what's happening? Well, it turns out that heat actually reduces the quality of the air that we breathe, And this means that people who have any kind of lung compromise or who have a tendency to allergies can get into greater trouble. And this is obviously a widespread reality around the country. So here's the story of Dr. John Meredith, who's an emergency medicine physician in North Carolina. They had a fire in 2008 in a bog in the northern part of the country. And it was a very dry year. The fire went on for some time, and there was a huge smoke plume that spread across the state. He thought that he was seeing more people come into the emergency room with lung problems and heart issues as well. And so he and some other physicians decided to study this in a systematic way. They looked at the counties that got the smoke plume and compared those with the counties that didn't get the smoke plume. And what they found was that people who were in those counties who had the smoke plume had a 50% increase in trips to the emergency room for respiratory illnesses like COPD, pneumonia, even bronchitis, and that the spike also caused an increase in emergency room visits for heart failure and even for MIs. And so this graph just shows the extent to which fires have been increasing, especially in the western United States in recent years. And so on the left is 1980, on the right is 2010. I don't know how well you can see this. It may be that we need some more lights down so that you can see it well. But clearly, the fires are increasing. And those numbers, 56.7 degrees and 58.4 degrees, that's the average temperature in those years. Okay, so the second health impact, or the second impact, comes from extreme weather. We have an increase in severity of heavy rains. This can cause displacement because of flooding. It can cause power outages where people lose refrigeration, access to medicines that they need, access to clean water. And this can harm anyone, but people who are involved with emergency evacuations have additional problems in that they're displaced from their communities, sometimes for prolonged periods of time. And so not only can it impact their health directly, but it also disrupts social networks and causes mental health stresses. And so this graph here just shows the increase in extreme precipitation events. On the left is the 1900s, on the right is the 2000s, and you can see that extreme rain events have been increasing over this period of time. The graph is just those events that are greater than the 95th percentile. And so those extreme precipitation events have been increasing. And this is the story of Dr. Claude Telus, who is a retired critical care physician in Baton Rouge, Louisiana, who was living there in 2016 when there was an extreme rain event. They had more than 20 inches of rain in a short period of time. And that red area you see on the map of Louisiana, that's the area that was flooded. It was almost 30% of the entire area of the state that was flooded. This is not Katrina, which was further south in New Orleans. This is the Baton Rouge area, which is where people had evacuated to during Katrina. So there were 30,000 people who were rescued, 10,000 ended up in shelters. A lot of people left their medicines behind. There was a state of emergency. Houses were ruined. Months later, 6 months later, there were still refrigerators and building materials piled up on the curbs. And it was a crisis for many people. And it was, in addition, a period of great stress, depression and anxiety. And long after Dr. Telus had helped with other physicians to get medications for people who had been evacuated, who left their medicines behind, the kids in school were having great worry every time it rained. They were terrified that it was going to flood again. And so he heard about this from the teachers in the local schools. So people who are exposed to these extreme events experience stress, can be mental health problems. For those who already have pre-existing depression or anxiety or substance abuse issues, this can push them over the edge. and lead to PTSD, suicidal thoughts, behaviors, etc., and to worse substance abuse. And these kinds of things have actually been now well documented in studies that have been done after Superstorm Sandy, after Katrina, after other extreme events. So just to mention, that not only do we have all these health impacts, but in 2017, there was actually $300 billion of loss because of extreme events around the country. So that was a record, it's a tremendous record. Okay, next is extreme heat. So we have more very hot days, high humidity. If the humidity is high, the sweat can't evaporate as well, and that can cause the heat index to rise, and so the impact of the heat can be even greater. And we can get heat-related illnesses, death due to heat strokes or dehydration, and this can also worsen some chronic diseases like pulmonary diseases and renal diseases as well. Anyone is at risk, but again, people at greater risk are kids who are spending more time outside, the elderly, pregnant women, people who don't have air conditioning, and there are a lot of people who don't have air conditioning around the country, and people who may lack air conditioning when the power goes out or have nowhere to go when the power goes out. We've all heard the stories about those trapped in nursing homes, et cetera, after storms. But there's many other situations as well. So this is the story of Isaac, who is the 11-year-old son of a pediatrician in Northern Virginia, Dr. Samantha Adut. And she got a call from the emergency room when she thought her son was at band camp playing the clarinet. Turns out he had collapsed. Parents rushed to the ER, and he had experienced heat illness as an 11-year-old. The heat index was actually over 120 degrees on that day, but that moment was a key for her. And she has since started a group in Northern Virginia called Virginia Clinicians for Climate Action that's affiliated with us. And there are these groups that are starting in states around the country. There's a Florida Clinicians for Climate Action now, and an Ohio Clinicians for Climate Action, and there are groups in Minnesota, and in Utah, and in Vermont, and in California, and other groups starting up looking at the local issues that are faced on the ground. Okay, so this is another young sport player who was playing football and collapsed and almost went into kidney failure, rushed to the hospital. Fortunately, his life was saved, but that could have been a tragedy. So moving right along. So it turns out that young kids who play sports are actually more vulnerable to heat illness, and about a third of all the ER visits for heat illnesses are actually young people who are playing sports. I know, that's a really surprising statistic. It really surprised me when I learned it. And football is one of those sports where there's more likely to be a problem. Okay, so what about mosquitoes and ticks, insect vectors? So we have changes in temperature, changes in rain. All this can affect the insect population, and this is leading to increased numbers and range of some of these vectors, and anyone can be harmed. But again, those who are spending more time outside are more likely to be harmed and are more likely to be vulnerable. And so this is the story of Dr. Nitin Damle, who is an internist in Rhode Island, and who used to see 2 to 3 cases of Lyme disease a month during the season. Now he and his partners see more like 40 cases of Lyme disease during the season. So they went from 15 during season to 40 during season. And he is immediate past president of the American College of Physicians and has been spending his time now going around the country to ACP chapters and in fact around the world and speaking about climate change and health. So other impacts of climate change include contaminated food, which can occur both because of the heat and also because of the flooding. that's happening that carries sewage and can contaminate the farm, agricultural products, contaminated water, and threats to nutrition, because as the carbon dioxide level increases, the protein content of some of our main staple crops actually declines. And that includes wheat, rice, and soybeans, more so rice than the other two staple crops. But I know a botanist who has done a lot of research on this, and he's now partnering with scientists in China who are extremely concerned about the impact of increased carbon dioxide on the quality of the rice crop. Okay, so what can we do? We go into our offices, taking care of patients. What can we do to address this? Well, one of the things is to help our patients get climate health smart. Help them to protect themselves from the harms of climate change, whatever they happen to be, where we're practicing. We can tell them how climate change is connected to health. So again, they have the information that can help to protect themselves from these problems. We can tell them that being energy smart is an important part of being health smart. Reduce energy use. Choose clean energy if it's available in your community. In many places, you can actually buy solar or wind-generated energy from the grid. And we may want to talk directly to our patients. This is very much an individual decision, and it depends upon how much time you have. But with regard to heat waves who affect children and elders and outdoor workers and people with COPD and asthma, we may want to spend time telling them to be really careful about hydration in a heat wave. Check the air quality index. Make sure that they increase their medications as needed during periods of greater heat. If there are wildfires in the area, be aware that that smoke can travel hundreds of miles, literally, and that, again, they may need to check the air quality index, especially those who have lung compromise, because they may need more medications. For those who have allergies, they may take their medicines earlier. They may need to watch the pollen levels. For those who are subject to floods and storms, we can have preparedness handouts in the waiting room. For those who have mental health diagnoses, we can give them warnings that heat may actually decrease the impact of some of the medications that they're taking. They may need to up their medicines because heat does decrease the impact of a number of mental health pharmaceutical products. Okay, and what can you do now? Well, you can eat and move for wellness and sustainability. You can cultivate energy-saving habits, buy electricity again from renewable sources if they're available. If you're able to buy an electric car or put solar panels on your home or contribute to community co-ops that buy solar panels, many places are increasingly having choices like that available. You can choose active transportation whenever it's available rather than getting into a car which pumps emissions into the air. You can avoid disposable water bottles, carry reusable containers, eat less meat, buy locally grown fruits and vegetables, be a voice for a better future. Learn how climate change affects your health and your community's health, and tell policymakers you want solutions to climate change. This is a year of elections. If you go to any forums, you can say, you know, what's your plan for addressing climate change? Do you have a plan for addressing climate change? How are we going to address climate change in our state? And remember that climate change solutions offer health benefits. So clean energy creates less soot, less pollution, and healthier air. Active transportation, like walking, biking, or public transportation, are cleaner and better for health. Diets with more vegetables and less meat are healthier and produce less methane. Cities with more trees and cooling greenery absorb more carbon dioxide and help protect people from heat. And this is just a few pictures. Thank you very much.